talk, and she got me involved with two organizations. Physicians for a National Health Program, and it's mainly for physicians, but they have a network across the whole country, and they're doing wonderful work at working towards a single payer system. And then the local one in Massachusetts is called MassCare, and that's the organization that I've been working in really for the last 25 years. As I got interested in the subject, I really began to become aware of all the problems in the healthcare system and how it affects patient care. So I'm asked myself some of these questions. Why are so many people unable to afford medical care? And actually medical bills are the most common reason for going into bankruptcy. I mean, that's a terrible thing. Why do so many people lack access to health care? I mean, rural communities are hard to find doctors in. You have to travel long distances. That's not really right. And then in the cities and towns where there are sections of low-income people, there usually aren't many doctors or facilities available for healthcare. This isn't right. Why do Black and brown people always have the lowest healthcare status? As Dr. Reverend Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And this is so good. Private insurance companies?
Nope.
No. They act as the middlemen between patients and doctors, causing huge administrative costs, and give the insurers huge profits that come out of the system. Why are community hospitals closing or being bought up by big hospital chains? This isn't right. Why are private hospitals costs rising so much that patients are afraid to go to the ER, afraid to go to the hospital because of the cost? It could bankrupt them. Why is the system so complex? Medicare covers the elderly. Medicaid is for low-income people. Job-based people get insurance through their jobs. And other people just get private insurance on their own. It's a very complex system, and it makes it hard to correct because there's so many levels you have to deal with. The latest problem, and this is a very serious one, is the privatization of healthcare. Medicare is the only one really that is publicly financed. Unfortunately, though, part of Medicare, actually 50% of regular Medicare, has now become Medicare Advantage. And this is a totally private system. It has nothing to do with Medicare anymore. It sends you to your insurance company, and you have the co-pays and the co-insurance and the premiums and all that. But they entice people by giving them a few extras, like you can have gym privileges. Well, of course, that will select the people who are most healthy and will have the less cost. So the insurers are making lots of money on this. The last thing in privatization, and it started under Trump, is what's called the REACH program. And this is where private equity companies and venture capitalists are taking over private practices of medicine. And I mean, the idea, these are companies that are out to make money. Medicine has now, for corporate interests, become the big moneymaker. And that's why they're creeping into whatever good medical organization we have. If I just, these are some figures that are just hard to believe. People who are on regular Medicare, they get 98% of the cost that goes into the program, and only 2% goes to administration, and there's no profits in that system. If you do Medicare Advantage, 85% goes to patient care, 15% goes to profits and administration. And the new program, REACH, 60%, only 60% goes to patient care, and 40% goes to administration and mostly profits. So these are some of the things that are going on in the healthcare system now. And it's for people like us who believe that healthcare is a human right, the only way forward is to really work for a government-run, and people call it different things. I like to call it single payer because Medicare now has been sort of tainted, so but Medicare for all also works fine, or government-run one system. What has been accomplished towards getting a single-payer system in Massachusetts? We have a wonderful bill. It's been put out every 2 years since the end of, well, in the 1990s, I think was the first bill. And it's been updated every 2 years. It's called an Act to Establish Medicare for All in Massachusetts. And I can give the current House bill and Senate bill if you want to hear it, but House is 1239 and Senate 744. The lead sponsor is Senator Jamie Eldridge, who's the senator, and there are 2 representatives who are the lead sponsors, and Lindsay Sapadosa and Denise Garlick. Dr. Gerald Friedman has been working on the financial part of it. He's at the University of Amherst, and he's been working on this for a long time, and he's a real expert. He's found that savings in our bill would be $34 billion to the state, even just in the first year. It would be paid for through fair taxation. The first $20,000 that someone would earn would be excluded, so you wouldn't be taxed on that. There would be no private health insurers unless it's for some operation that is not for health care. Seniors will get more services, eye care, hearing, dental. Businesses would no longer have to provide their own health care plans. This will really help small businesses in particular, because in a small business, the employer doesn't necessarily know anything about health care, and it's a real pain in the neck to try to get a good health care plan that your employees would be happy with, but won't be too expensive for the owner. So getting rid of the private health insurance companies really will make a difference in that sense. In cities and towns, people don't realize it. I didn't anyway for a long time. that each city and town has to pay the healthcare costs for all the town or city employees. Now, in big towns, that's an enormous amount of money. But under a single payer system, they don't have to do that. Again, that's a huge savings. Unions, they can focus on bargaining and issues that are really important to have them function. They don't have to bargain about insurance coverage, so that's another good thing. And the low and middle income people, they won't have to have the fear of out-of-pocket costs, you know, the premiums, the deductibles, the co-pays that add up, because we won't have the private insurance companies. So, if we could pass this bill, we hope that we can then be the inspiration for other states. And this is what happened in Canada. In Saskatchewan, there was one province, and then within 3 years, the whole country accepted. So, even though a single state can't capture all the savings, they can, and they have to get some help from the central government to do this. It really will make a big difference. People will see it can work. I think there are a lot of legislators who really believe that single payer is pie in the sky, it can't work. But all the other countries, you know, in Europe and around the world have some form of a government-run healthcare system. And there's no reason why, if we don't really push our legislators, that it can't be done. Other things that MassCare has done, and it's been kind of fun, since we started doing them, and I think it started in the early 2000s, we've done over 50 ballot questions in different districts across the state, representative districts. And we've won every single one of them. Every single one, more than 50% of the people have supported us. There are a few districts that have had more than one ballot question, and it's interesting that the second one, there's always more people voting for it. So we're moving in the right direction. We have several local hubs that meet together and work on their district, or it may be 3 districts or 2 districts that work together on getting support. We have volunteering in the MassCare office for doing all kinds of things, fundraising, contacting legislators, writing thank you notes, doing all the things you need to do to keep your organization running. And we're trying to get more co-sponsors of the bill. And that's been a very big push, and we just had a meeting yesterday, going out to our legislatures, and of course they weren't there. Anyway, we're doing it. Left messages and all kinds of things. And we are asking, we have a large coalition. There's 47 members of our coalition. Others, all different kinds of groups, you know, nonprofits, unions, some Democratic town committees. I know I shouldn't mention that here. Anyway.
That's all there are.
So,
we're not a choice but to mention that's all there are.
So we're trying to grow that as well, and each one of these organizations can push along as well. So, I think that's about all I really have to say. That's what we've been doing. And my last thought takes me back to the beginning, that the status quo leaves too many people without health care, and it's time to really find a better way.
Woo!